Hello everyone, today we are going to discuss serotonin syndrome. It is thought to be due to an overstimulation of the serotonergic system. It can result from medication combinations such as more usage of more than one selective serotonin reuptake inhibitor or combining the selective serotonin reuptake inhibitor with serotonin norepinephrine reuptake inhibitor or another combination like using the selective serotonin reuptake inhibitor or the serotonin norepinephrine reuptake inhibitor with monoamine oxidase inhibitors. So combining these antidepressants with monoamine oxidase inhibitors is another important combination that can result in serotonin syndrome. Also combining the selective serotonin reuptake inhibitor with tryptophan or the combination between the monoamine oxidase inhibitors with the miberdine. Also combining the monoamine oxidase inhibitors with the tryptophan. Although it is rare, but it is potentially life-threatening, and it is considered an important adverse reaction to the selective serotonin reuptake inhibitors and the serotonin norepinephrine reuptake inhibitors. Now, what are the symptoms of serotonin syndrome? The symptoms are including nausea, diarrhea, palpitation, chills, diaphoresis, restlessness, confusion, and lethargy, but this also can progress to myoclonus or hyperthermia, rigors, and hypertonicity. The treatment is mainly by stopping or discontinuation of the medication, plus the administration of emergency medical care as needed. That means it should be treated in the intensive care unit. Also, it is very important to distinguish from another complication due to drugs like neuroleptic malignant syndrome, which is considered an important complication or adverse effect of antipsychotic drugs. But the neuroleptic malignant syndrome is mainly characterized by high-grade fever and muscle rigidity. The clinical presentation of serotonin syndrome is including autonomic instability symptoms like diaphoresis, hypertension, and tachycardia. Also, neuromuscular activity symptoms like tremor, clonus, hyperreflexia, and muscle rigidity. Also, the patient can present with altered mental status presented as agitation, restlessness, confusion, and disorientation. In terms of pathophysiology of serotonin syndrome, we find that it can be due to increased serotonin release, and the drugs responsible for this increase in serotonin release can be like cocaine and amphetamine, MAMDA, and metrazapine. The cocaine is clinically characterized by increasement in the temperature and increasement of blood pressure of the patient. As you know, it is an alkaloid and it is increasing the dopamine and serotonin and also the norepinephrine in the circulation. Also, the amphetamine is considered an important drug in the treatment of the attention deficiency hyperactivity disorder, and also it is important as a treatment for the narcolepsy. Another important stimulator is the MEDMA or the MDMA, which is abbreviation for methylene deoxymethylamphetamine. It has many different names like ecstasy and molly. Also, this CNS stimulant is going to increase the dopamine, serotonin, and norepinephrine. Regarding the metrazapine, it is atypical tetracyclic antidepressant. It is not tricyclic, but a tetracyclic antidepressant drug, and it is having an important function inhibiting the central presynaptic alpha-2 adrenergic receptors. Another mechanism for the pathogenesis of serotonin syndrome is impairment of serotonin reuptake. Drugs that is going to impair the reuptake of serotonin, like the tramadol, which is a narcotic in addition to miberdine. This is the bethidine, known drug as bethidine. Also the dextromethorphan, which is a famous drug used as antitussive. It is going to have many actions, like it acts as a non-selective serotonin reuptake inhibitor, and also it is acting as a blocking antagonist for the NAMDA receptors. Also, it is an agonist for the sigma receptor, and in high doses it can act as dissociative anesthetic drugs. Also, sometimes we can find combinations between the dextromethorphan and the bupropion, which is used as a very fast or rapidly acting antidepressant. Another drugs that is acting as impairment serotonin reuptake or serotonin reuptake inhibitors, like the serotonin norepinephrine release reuptake inhibitors like the vanilla vaccine and the duloxetine. Also, the selective serotonin reuptake inhibitors like the fluoxetine, citralline, and citalopram. Also, cyclic antidepressant drugs. Also, selective serotonin reuptake inhibitors like fluoxetine, citralline, and citalopram. This sertraline, fluoxetine, and citalopram are famous for different side effects or adverse effects, like risk of increasing the risk of bleeding. So before surgery, we need to stop it. Also, they can cause closed angle glaucoma, and they can increase the risk of suicidality like the other antidepressants. Also, they are characterized by sexual dysfunctioning and sometimes can result in manic episodes if we give for patients with bipolar disease. And when the patient is taking this drug, we are recommending to avoid alcohol, because alcohol is going to make the side effects more prominent. Also, another group are the cyclic antidepressants like amitriptyline and clomipramine, but these drugs, cyclic antidepressants, should be monitored periodically by ECG. Also, they are considered in the side effects of sexual dysfunction, and especially the amitriptyline is very serious among elderly patients, can result in cardiac arrest in cases of overdose. It also causes QT prolongation, that is why it should be also monitored by periodic ECG. Another important drug is the bupropion, and the bupropion is a norepinephrine dopamine reuptake inhibitor drug. It has no serotogenic effects, and it is commonly decreasing the threshold of seizures among patients who are having bulimia. So we should be careful not to use bupropion among patients with bulimia. Also, it is very commonly used in patients with depression who are having overweight problem, because it can result in weight loss. Bupropion has many functions, like it is also used in smoking cessation treatment. Also, the methylphenylidate, which is used in the attention deficiency hyperactivity syndrome, and it is also a CNS stimulant like the amphetamine and the cocaine and the others. So it also can be used in the treatment of narcolepsy. Ondansetron is a 5-hydroxytryptamine antagonist, which is a very important centrally acting antiemetic drug. It is commonly used in those patients with chemotherapy, and sometimes can be effectively used to suppress vomiting among pediatrics. Another important group are the monoamine oxidase inhibitors, like the isocarboxazide, the linezolid, the phenelzine, the tranylcypromine, the moclobamide, and the selegiline. All these drugs are considered as monoamine oxidase inhibitors. During treatment of patients with these drugs, patients should avoid using tyramine-rich food like the old cheese, because it is going to induce hypertensive crisis among these patients. Another pathophysiology for the serotonin syndrome is the increasing receptor sensitivity. Like when we give lithium for patients with unipolar depression, when we combine it with antidepressants, this lithium can result in increased receptor sensitivity and result in serotonin syndrome. Also, the increasement in serotonin formation, like when the patient is using tryptophan as a supplement, which is an essential protein, and also it is very important for the serotonin production. It is needed by the body for the formation of serotonin. So also tryptophan can act as an important drug in the pathogenesis of serotonin syndrome. Thank you for your listening, and that was all for today. If you find this video beneficial, please share it with the others and don't forget to subscribe to my channel. Thank you.